Hey, 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 welcome back. It's your girl, Nurse Pia. I'm back with more NCLEX hot topics, and today we're covering NCLEX topic pharmacological and perennial therapies, which is 12 to 18% of your exam. So it's covering med safety, IV therapy, side effects, antidotes, dosage, math, and more. So let's get into it. Okay, so slide one, we have NCLEX high yield topic, pharmacological and perennial therapies. Blatantly states because meds can save or harm your patient. So let's talk about pharmacological and perennial therapies. A major NCLEX category. It's packed with med safety, IVs, and dose math. Okay, we have slide two, six rights of medications. These are the basic six rights of medication. They're adding on more now, but these are the basic six. Right patient, right medication, right dose, right route, right time, right documentation. So you never want to miss the six rights. They're the foundation of safe medication practice. So these are our high risk medications that you must know. I'm not going to go over each medication. You can go ahead and take a look at the table and go over it as you need. These meds show up constantly. Know their labs, toxic signs, and how to respond when something goes wrong. Okay, slide four, IV therapy basics. So confirm compatibility. Make sure. Prime your tubing. You don't want any air. Monitor insertion site for redness equaling phlebitis, swelling, and infiltration ultimately. Change tubing per policy. Use pump for high alert meds. IV therapy is all about precision and observation. Always check compatibility and never ignore a red, swollen IV site. Okay, so slide five, we're talking blood product administration. So some of our tasks are for an RN only task. So when we're in the hospital and we have to do blood administration, we're looking at things such as type and cross match. You're looking at that to be an RN only task. You want to verify with another RN. You want to stay with the patient for at the first 15 minutes at least to check for any side effects, adverse effects. Um, you want to stop if fever, chills, hives, or the patient complains of chest pain. Blood transfusions. You never delegate a blood transfusion. Monitor closely and stop immediately if a reaction begins. All right, so slide six. These are antidotes to know, a quick reference guide. So on the left hand side, you'll see the toxins and the drugs. On the right hand side, you'll see the antidotes to the toxin or the drug. I'm not going to go over each one. You guys can go over these and, read about them and hopefully you understand them all before you get to NCLEX because these are very important. Antidotes are like NCLEX gold. Know what to give when meds go wrong, especially Narcan, vitamin K, and Mucomist. Slide seven, dosage calculation, OMG. All right, so let's just dive into it. The basic formula, you're going to get desired over half times your volume equals your dose. Watch the units when you're doing this, microgram versus milligram. Make sure you have the correct one. Double check pediatrics and high alert meds. I can't express that enough. Don't fear the math. Use your formula and double check pediatric doses, especially weight based meds. You'll be fine. Okay, slide eight. We're almost there. Med safety tips. So, you want to clarify unclear orders. Don't crush enteric extended release tabs. Check all allergies. Use barcode scanning if available. Never leave meds attended. Please don't do this. Monitor for adverse effects. Medication errors are preventable. When in doubt, you just clarify. And never crush that extended release tablet. That's the whole point of it. All right, so we're wrapping it up now. So this is our checklist. We have come to the end. We went over the six rights, high risk meds, IV and blood product rules, antidotes, dose math, and med safety tips. You crush this section by mastering safe med practice, knowing your high risk drugs, and calculating with confidence. And you will get through this NCLEX. I promise you. This is your girl once again, Nurse Pia, back at you with more content. Like, share, follow. If you got any comments or any topics you want me to cover, drop it in any of my chats. You all have a good one. Until next time. Bye bye.